just going to record it. So this is Dr. Shah. I'm going to explain you about where the root of the problem is for you. We're talking about essentially a need for weight loss. So what I'm going to do, I'm going to go ahead and give you this book, which has every food you can ever eat in there. Okay. And you're going to look it up every morning that, okay, you had a skim milk. You just look it up, it's 40 calories or 60 calories. You had a toast, or you had an apple or a banana, whatever. You look it up, you write down in a book, in a very formal way, in a notebook, like a school notebook. You write down a date and write down breakfast and, total 5 small meals, just like you should do it for as diabetic.
Okay.
And you write down every day. So you probably will have 1 page for date. Every day you will have 1 page. And you will start writing it down, count the calories at the end of the day, and then total them up to 14 to 16. 1600 would be a good start. You are a good sized person, so maybe once in a while 1800 is fine. But try to stay around 1600 if you can. And it's going to be hard sometimes. But as long as you're writing it down, at least you know that you are going above, and next day you will adjust it if you can. The second thing is, I'm going to go ahead and ask you to come and see our nutritionist. Her name is Tina. She has lost weight herself, about almost 50-60 pounds. So she knows how to do it, and as a patient also. She's just not somebody who's just gone to school and says, I can tell you. She has done herself. Mm-hmm. And also she is an exercise trainer too. So I think she's going to help. And fortunately, I asked her how much are you going to charge, and she said $50 per patient. So I said, do you mind if we put 10 people in one room?
Yeah, that's nice. Yeah.
And we'll just pay $5 per person.
Mm-hmm.
So that way it worked out. She said, I don't mind, as long as people don't mind. So she teaches everybody in a group.
Okay.
So we're going to put both of you through that. And you can do it once a week, once a month, twice a month, as much as you want. Every time you come, you pay $5, just like going to the movie. Mm-hmm. So I think to me that's the right thing to do. So we're going to do that. And then my office will periodically call you and ask you how is it going with the diet. I think to me, let's get 7 pounds, in your case 7 pounds a month, you can easily get off. And as you go off, your sleep apnea will be gone, your knees will get better, your diabetes will be better, your cholesterol will be better, your blood pressure will be better. I mean, to me, it just sounds too good not to do that. Now, is it easy to do? No, it's very hard. We all have problems. I need to lose 15 pounds. We all have problems. But I think to me, 2010 is the year we're going to do it. So right now, I'm not going to get focused on anything else. Even the sleep apnea, I'm just going to hold up, because if you're going to start losing 10-15 pounds over the next few months, even sleep apnea will get better. That's one thing. Second thing, you need to start exercising. Now you are retired. So you need to figure out what fits your body needs. Okay? For example, if you had some nice expensive car, and the only dealer in the state is in Grand Rapids, but you like the car so much, you will go to Grand Rapids for oil change, right? Because you like the car so much.
Right.
So you just have to figure it out. Your body is like an expensive car. You just have to take it to a place where you can get the best tune-up. So if it means you have to go to YMCA every day, you go to YMCA every day. Why? Because you can swim there. You can go walk in the water. You can use elliptical. You can use bike. You can use light weights. So without hurting your knees and hips, you can go ahead and burn some calories. So I think to me, as you're retired, it only makes sense to put all the time into you. Put all the money into you, not anywhere else. Is it easy to do? No, it's not. But it's something required. I think you should do it before something happens, not after stroke and heart attack happens.
No, I don't want that, no.
I'd rather have you do it before, because we have a lot of time on hand right now.
Right.
So I think you're going to start doing it, and my office will help you, and we'll call you periodically. And I won't be surprised, frankly, a lot of this medicine starts coming down. That's the goal. So we'll do it together. And stay well, happy holidays, and we'll get you going.
Okay.
All right, very good.
For your information.